In this video, we're going to show you the 3 best stretches when you're dealing with hip bursitis and lower back pain at the same time. My name is Sebastian and this is Desiree. We're part of the locally world famous chiropractors in Costa Mesa, California. Des, what is hip bursitis? Just so everyone knows what we're talking about here.
True hip bursitis is anytime you hear itis, it usually means there's some sort of inflammation. Hip bursitis that most people will feel is going to be right here on the outer aspect of the hip, right where like the hip bone sits.
Yeah, the lower back pain we're talking about today is a lot of you will probably feel it like right around like this area here, and it may go up into this area here, and maybe partially into like the tailbone or sacral region.
Yeah.
Okay. So we're going to get right into the stretches now. Which one do you want to start with first?
The first one we're going to do is we're going to kind of hit 2 birds with 1 stone here. So we're going to do the opener. So an opener, Seb, if you want to be our model today.
Okay, this is my symptom side then, right?
Yes.
Okay.
So we want symptom side up, and I'm going to stand behind him. So what we're looking for here is he's got a nice straight line. He's going to pull his knees up towards his chest a little bit, and I want him to try to create some space underneath his body. I like to say like you're making a rainbow over the top side, and we're trying to open up some space for the nerve roots to come out and flow down. Would you agree with that?
Yeah, so this addresses part of the low back part. How do you think it deals with, because we're going to kill 2 birds with 1 stone, how do you think it deals with the hip bursitis part?
Well, with hip bursitis, it's an overuse thing. So this is a nice gentle stretch of the hip muscles because as you're going into this flexed hip position, you're stretching out the muscles of the gluteal region.
Yeah, especially if we bring this hip a little bit more forward. This is a pretty narrow bend, so it's not like we're going to be able to get into the best position for it. But some people leave their legs really long. In that case, the muscles are a little bit more shortened, like the gluteal muscles and the ones that attach into the hip, the side of the hip where the bursa is. And if you bring a little bit more like in the crouch position, like Des said, this is going to be more forgiving on both of them. So slight modification on a problem that we see often. How long would I hold this position?
This one we like to hang out for about 2 minutes.
Good. Now, what if my feet were I was just kind of hanging right? Is this okay?
You want to relax. You want to let those legs dangle. A lot of times people will hold the tension, and that kind of creates the opposite effect of what we're trying to do right here.
Yeah. There's other exercises that strengthen the area, but in this case, we're covering 3 ones that kind of get it to relax, get both areas relaxed at the same time. 2 birds with 1 stone, right?
Absolutely.
Okay. The next one we wanted to do was, once you go in the front over here.
Okay.
Which side do you want?
Here, I'll lay down like so.
Perfect. And so, scooch a little bit to me. So a good starting point with this one is just being down into, this is the propped position or the sphinx position. And so this one targets more so the low back. The other one gets a little bit more of both. But this one's really, really helpful just to settle down a part of the back, which may be contributing partially to part of the problem that's going on in the pelvis, creating the issue with overuse of the musculature in the side of the hip, which creates hip bursitis. A lot of times the mechanics that create the hip bursitis are, can you show an anterior pelvic tilt? There you go. So she's really forcing down because the musculature of her back is so active. So go ahead and relax again. So being in this position first is a really nice starting point to let the muscles relax. And then we're going to challenge a little bit more of pushing the low back into extension. Can you go up into the pushing up? There we go. And coming down. Good. And so what this does over the long term is, again, this settles down the low back musculature so that the pelvis can stop going into an anterior tilt, creating the cycle which creates things like hip bursitis. Now she's holding the position right here, but there you go. She was waiting for a cue to go down, right? So she's going to keep continual movement, okay, up and down and relax. So she might even go face to the floor, okay?
All the way down.
Yeah, just a minor break and so on. So this is a nice one to do. Do you have anything to add for this, Des?
For this one, just make sure that you're not squeezing the tushy. I know it's kind of hard to see, but you want to make sure that you're not flexing the butt cheeks while you're going through this, because that's going to, like Seb was saying, kind of reproduce the same issue that we're trying to address right now.
Yeah, we want everything to generally relax on these ones, because what these stretches do, they relax things, right?
Yes.
Let's just chill. Okay. What's the last one we want to cover?
The last one we want to cover is going to be a pigeon stretch.
Okay.
So stretching again.
I've seen pigeon before. Is this different?
This one's going to be different. That's a great question. So we are going to modify the pigeon stretch on a bench today. So same concept. You want to have the shin relatively what's the word, perpendicular to the body. And he's going to take that back leg and step it back a little bit more. And he's doing it at an angle just so you guys can see a little bit better. But this allows the torso to stay more upright as he's doing the motion. So again, we're kind of limiting some of the stress on the low back while still stretching out the muscles of the gluteal region surrounding the hip and also around the bursa.
Yeah, I feel like if I rock in a little bit, I feel a little bit more in the glute, like glute stretch. Does that sound right?
Absolutely. Sounds about right.
Yeah, and you shouldn't really feel any problems up into here. If you do, then this is not the right one for you. But ideally, you just kind of rock in and hold a little bit of a glute stretch, right? And then rock out of it again.
Yep.
Is it okay if I, like, say this is like a bed and I got a big space? Is it okay to go like this with it?
It's okay as long as it's not producing the back symptoms. So that's a really good question. Some people are experiencing both right now. So the flexing forward, like he's trying to demonstrate, might actually produce more pain symptoms here if there is a lower back component going on.
Yeah, some of the lower back components that it may actually increase when you do something like this is like some type of disc irritation, a herniation or bulge, if you will. While some people who might be into their 80s and 90s and 100s, like this would actually work out really well for them because they have things like foraminal stenosis and facet irritation.
Yeah.
But this would work probably better for a younger population.
Yeah.
This might work a little bit better for an older population.
I'd agree.
So if you guys are dealing with hip pain, but you feel like it's in combination with lower back pain, these are just a really good starting point of stretches that you can try. Typically doing them every day is a good idea, so you can come back to this video and follow along a little bit. But if you're struggling to find something actually really working out super well for you, and you're tired of having the problem come back again, just reach out to us. Our contact is below. We'd love to make something more structured for you after we do an examination and learn more about what's going on with you. Anything to add?
No, I think that's it.
Okay, subscribe to the channel. We'll see you guys next time.